Today I'm your physio. Can you please introduce yourself?
Yes, so I'm the Koning, and I came here for some help with my back.
And how old are you?
I am 42.
Okay. Mrs. the Koning,
Yes.
I already read your case from my colleague, and but I would like to ask a big question, to just know more about the pain, and then I will continue to the examination to see more about your pain. And so tell me, can you show me where do you exactly feel the pain? Because I heard that you have a lower back pain, yeah?
Exactly. I can really feel it right around here, and I can really feel it when I try to get something from the ground. That's when it's the worst. But yeah, it's around the lower areas.
Okay, so the exact location is here.
Yeah, exactly.
And you said that the activity is bending and bending forward is not?
Yeah, the bending is really bad for my back. That's when I can feel it. But also, if I'm standing for super long, like at work, for instance, I'll realize my back starts to ache a lot if I'm just standing.
Okay.
Yeah.
And I already read in your case that you experience a lot of stress and.
Yeah.
Okay.
Yeah.
Okay. So, are you comfortable to continue with the examination?
Definitely.
Okay.
That's okay.
So, I'm going first to ask you to do the daily activity that you do, and to see how much is limited, and then I will perform some examination on you, the active one and passive one.
Okay.
And let's see. But before we start, can you? Is it possible for you to take off your clothes or no?
Yes, definitely. No problem. I've also got some shorts under the long pants.
Yeah, that would be perfect. It's okay.
Yes. Okay.
And I heard you're not comfortable to take off your t-shirt, but
yeah.
May I ask to put your under your bra? Yeah,
that's okay.
Yeah, that's perfect because I really want to see the back pain.
Yeah, no problem.
So, I'm gonna ask you to do some stuff that you said you already have pain, like for example standing, bending forward, and turn back to standing position, and stay in a standing position.
Okay.
Okay. So I will observe the postural and the movement things, and if it's not comfortable for you, if you have really pain or sudden pain or anything, just tell me. And also, whenever you're doing that, just tell me from 0 to 10 how much is painful for you. 0, it's been nothing. 10, it's the worst pain that you can experience. Okay. And that's fine?
Yeah, that's fine with me.
Okay. So I'm gonna ask you to stand from the chair.
Okay.
And if you need help, whenever, just tell me.
Okay.
If you're not comfortable, just tell me.
Yeah, for sure.
And can we walk forward?
Definitely.
Okay, that's perfect. So and can you bend forward like you want to pick something from the floor?
Sure. Yeah.
Yeah. If you're really limited, it's not necessary to really bend forward.
I mean, I can
only this. This is the
that's
limited.
About us. Yeah. Okay.
I see that's it's painful for you.
Yes.
And you have a big jerky movement pattern.
Yeah.
And also, can you I already observed that you were in this position, and we come back to the standing position, and I'm going to see how you're standing prolonged right now.
Okay.
I'm gonna ask you how much pain is it? Is it you cannot stand or is it fine for you?
Standing for now is okay. I don't really feel a lot of pain. But if I were to be standing for a long time, I'd give it a 7 out of 10, I think.
Okay, because right now you're standing for
I
think 30 seconds maybe.
Yeah, I can stand still, no problem for short periods, but it's just when it's long I really.
But now it's fine for you.
It's okay.
Okay, now can you please sit here? But based on the things that I see, that's bending forward, it's painful, and there's some jerky movement pattern, as I said.
Yeah.
And also and also like coming back from the bending movement to like a standing position, it's also a problem.
True.
So the first thing that I'm going to do is the examination. I'm gonna first do the active movement, like active examination,
Okay.
and to assess, like to see you will recognize the familiar pain or not.
Okay.
And so first I'm going to ask you to do flexion, which means I will just lower the back and the table.
Yeah.
This is not necessary. The movement is doing by yourself, but for the passive one, I will do it. So I'm going to ask you to put your hands like this, and like this. Yeah.
Sorry.
And can you please bend forward, like do the flexion as much as comfortable you are. And whenever you feel the pain, just tell me.
Yeah, I can feel it.
Okay, that's perfect. I mean, the movement was
Yeah.
perfect, but the pain, that's fine. And can you do the backward, like the extension?
Yeah.
As much as you can. And do you feel the pain? Yeah.
Yeah.
Okay, that's fine. I don't want to bother you actually. And now we want to do the lateral flexion.
Okay.
Which means again in this position and bend on your side, in the right side, and
Oh, the left side.
this is right.
This is my left.
Yeah, that's left. Yeah.
And
And the right side.
a little pain, but it feels.
In
better.
your left side was
The left side
more
was
than-
so much
Okay.
more. Yeah.
Yeah, I understand. And the next one, I'm going to do the passive movement.
Okay.
And so is it fine for you if I touch you?
Yes.
Okay. So again, can you do this?
Yeah.
I'm gonna lower it. Okay. I'm gonna do the movement by myself, but I will ask you, of course, to do some, like, help me.
Yeah.
But try to be relaxed as much as you can. And I'm gonna see if the muscle are in a relaxed position.
Okay.
Again, you feel the pain or not? Okay.
Yeah, that's okay.
I'm gonna fix your sacrum and so can you please bend again as much as you can? Yeah, that's perfect. Did you have pain?
No.
Everything was fine with you?
Yes, that was.
And now we're gonna do the backward. Is it fine?
A little bit of pain, but
Okay.
yeah.
And now we want to do the 3D extension, which means that we do the extend.
Yeah.
And come lateral to me and rotation. This is your right side. That's good. And it was painful.
A little bit.
Okay.
A little bit.
I'm going to do the left side as well because it was painful for you as left
Yeah.
side to see if it's painful again or not.
Mhm.
And okay, again to come lateral.
Yeah. Oh, I can feel it.
Okay. This is the end.
Yeah.
Okay.
Yeah, that one hurt.
Yeah, I can feel the range of motion and the stiffness also.
Yes.
And okay, I did the examination, and I like to do some functional assessment and like the movement to like check your pelvic stability or something like that. Sometimes the pain may maybe come from there.
Okay.
Like from the stability of the pelvic things.
Yes.
So, can you please take your shoes off?
No problem.
Yeah. Yep. I will assess this based on like 2 tests. First one is active leg raise test,
Okay.
and the next one is pelvic bridge.
Okay.
So, I'm gonna ask you to lie down on your back.
Yeah.
Okay. And can you please bring your leg up a few centimeters from the table?
Oh yeah.
And do you feel pain?
Not really, but I can't really keep my hip down.
Yeah, I see. I can
Yeah.
see that. And the other side, please. Okay, that's nice. And now we do the next one,
Okay.
which is a pelvic test. So a pelvic bridge test. So I'm gonna ask you to bring your hip up from the table and like make it like as that in that position for like maybe 10 seconds or something like that.
Oh.
I want to see like if you can hold it or not.
Okay.
It's fine for you?
For now, but
Yeah, it's fine.
yeah, I can't hold it more.
Yeah, that's
I'm sorry.
Okay. The examination session, I think it was fine for me. I see the thing that I should see, and you can sit and come back to the position. Okay, how you feel now after we did some examination?
Pretty good. I feel like I was able to show you what really hurts me,
Yeah.
and then yeah, I've just realized that there's a lot going on, and it's a little difficult for me to continue with everything going on. So I hope we can do something about it soon.
Yeah. Based on the examination, I observed like the painful and reduced control, like bending.
Yeah.
And coming back to the standing position and stay like standing like for prolonged time. And I see like in a lumbar extension, like it's provocative lumbar extension, and also because you couldn't like stay on like, for example, for the last test we did, like pelvic bridge test.
Yeah.
And you couldn't like hold for 10 seconds. So I guess it might be some instability in your pelvic region.
Okay.
And but I think we can like with some treatment or something like that, which it's gonna happen the next session. We will consider this physical examination, and I will plan the treatment for you, and based on, of course, your goals. And yes, this was for this session. But do you have anything to add, or do you think that I didn't do, or you want like more expectation from me that didn't happen?
Yeah, I think everything was great. Thank you. I think I was able to explain myself very well,
Okay.
and I hope to see you in the next session.
Yeah, of course.
Thank
Yeah.
you very
Thank
much.
you.
Bye.
Have a nice day.
And